Mrs. Jones. My name is Lexi, and I'm going to be your nurse today. Are you able to tell me your name and date of birth? And she does, and it matches. Alright, I'm going to provide for privacy. Miss Jones, do you know of any allergies that you're allergic to? She doesn't have any, and that matched what the MAR said. Today I'm going to be administering an IV. The reason for putting in an IV is because you have some IV meds that are coming up. The IV, there'll be a needle that inserts into your forearm, but it will not say, only the catheter will. Do you have any questions? She does not. So I'm going to ask if you could distend your arm, which she does, so she's following commands. If this were to be a child or someone confused, I would get a second person in here to help relax or maybe distract them. Miss Jones, is there any reason why you wouldn't be able to use your non-dominant arm today? Have you had any fissulas, any mastectomies? She has not. I'm feeling her arm and it's feeling great. I'm thinking about using this vein because it is straight and it is distal from any joints. So I'm going to go ahead and put this barrier down just in case we have any messes. I'm going to place a tourniquet, which is not able to stay on an arm longer than 2 minutes. If I was unable to find the vein, I would ask that she pump her fist. Otherwise, I could place a warm pack. That would also help. Before I put the tourniquet on, I'm just gonna gather my supplies here. Alrighty. And I am also going to be priming this tubing. I'm priming it with normal saline. It's not the right side. Okay. So I would have cleaned that before. Going to prime it. It's primed. Putting this back on to keep it sterile. And now I'm going to wash my hands. Put on gloves. Alrighty, I have all my supplies in place. So I'm going to go ahead and tighten this, making sure that it's 15 to 20 inches or centimeters above the joint. And now with an alcohol, I'm going to go ahead and clean the site, making my way out. I would have gotten my tape ready too. Alrighty, Miss Jones. For touching my glasses, I would have washed my hands again as well. I'm gonna pull the skin taut. I'm gonna go in at keeping the bellow up, going in at a 15 to 30 degree angle, waiting for the flash, and then going down. Now that I'm in, I'm moving the tourniquet. Going to hold, and I'm going to pull out the needle, and then I'm going to attach the normal saline, where I'm going to flush to make sure that there is no infiltration, which I'm not seeing. So I'm going to go ahead and tape this down. And then I'm going to get this adhesive. adhesive. Place that as well. Okay. Get this piece. You can go ahead and clamp this. Take that off. And then I'm going to go ahead and stick it right under here so it's out of the way. Then for my agency protocol, I will write the time and the day that I inserted the IV. All right, Miss Jones, how are you feeling? She's feeling fine. Alrighty, so then I'm gonna pick up everything. Then remove my gloves, and I will document. First, I'm gonna wash my hands, and I would document the date, the time, the IV gauge, the type of IV, the type of solution, how much solution I administered, how many attempts it took me, and how Miss Jones was able to tolerate it. And I did forget that when putting on the tourniquet, you would also feel for the pulse to make sure that blood flow is still happening. And that would be it. So I would take care of my stuff and wash my hands.